Hello and welcome to Neurodiverse World, the channel that invites you to see the world with more empathy, science, and inclusion. Today we're talking about a topic that causes a lot of confusion, and sometimes prejudice, Oppositional Defiant Disorder, or ODD. Maybe you know a child or teen who seems to challenge every rule, confront adults, or say no to everything. But is this defiance poor parenting? Or is there something deeper going on? Let's find out together. What is ODD? Oppositional Defiant Disorder, ODD, is a behavioral condition usually diagnosed in childhood. It is characterized by frequent defiant behavior, constant irritability, resistance to rules and instructions, a tendency to argue or provoke authority figures. It's as if the child is always in confrontation mode. But this does not mean they're bad or spoiled. In fact, ODD is a recognized condition backed by science with neurological, emotional, and social roots. Common signs of ODD. Not every stubborn child has ODD. What sets the disorder apart is the frequency, intensity, and impact of the behaviors. Common signs include easily triggered anger, frequently refusing to follow adult instructions, constantly questioning rules, provoking others on purpose, blaming others for their mistakes, holding grudges, or seeking revenge. Intense temper tantrums, especially when told no. These behaviors must persist for at least 6 months and negatively impact family, school, or social relationships. What causes ODD? ODD doesn't have a single cause. It results from a combination of factors such as genetics, family history of behavioral or emotional disorders, environment, exposure to stress, trauma, or unstable relationships, brain differences. Studies show changes in brain areas related to emotion regulation and impulse control. ODD often occurs alongside other conditions like ADHD, attention deficit hyperactivity disorder, anxiety disorders, learning difficulties, autism spectrum disorder, ASD, how to support a child with ODD managing. ODD takes more than patience. It requires strategy, empathy, and professional guidance. Here are some key approaches. Set clear and consistent boundaries. Rules should be predictable and consistent. Use direct, simple language. Reinforce positive behavior. Celebrate cooperation. Praise more than you correct. Avoid unnecessary power struggles. ODD children don't respond well to direct confrontation. Instead of yelling or punishing, use calm responses and offer choices. Stay calm, even when it's hard. Adults must be the emotional regulators. This doesn't mean permissiveness. It means being emotionally present. Seek professional support. Psychologists, psychiatrists, and behavioral therapists can help. Sometimes family therapy is needed to reshape interactions. Can ODD be treated? ODD doesn't have a cure in the traditional sense, but it can absolutely be treated. With early intervention, consistent routines, supportive relationships, school accommodations, personalized therapy. Children with ODD are not bad children. Their behavior is a message. I'm overwhelmed. I need help regulating my emotions. If you know a child or teen showing these signs, don't label them. Support them. Listen. Try to understand. Here at Neurodiverse World, we believe that every behavior is a form of communication, and that with compassion and knowledge, we can turn conflict into connection. Share this video with someone who needs to learn more about ODD. Like, comment, and subscribe to the channel for more content on neurodiversity, because understanding is the first step to inclusion. See you in the next video.